COVID-19 coming from France, just across the channel,
Yes.
is actually going to be coming to them, and it's going to be hitting them hard. So they fear for that. So I think it was timely. As a health expertise, I find that Kenya has decided on that, and it is good that they decided to reciprocate in the same way as Britain has done.
Yes, yes, and I'd like Dr. Parag to explain to us why these variants are causing governments to have such jitters. What is it about a variant of a particular virus that makes it quite a challenge in terms of ensuring that you are treating the masses and you not wanting it to spread?
Basically, government, you mean to say the barriers? Hello?
Dr. Parag, can you hear me?
Yes.
Yes.
The voice is breaking.
That if you can hear me, I'd like to know from you what it is about a variant of a virus that makes it more of a challenge, because we sort of have figured out how to handle the coronavirus COVID-19 as is. So why would a government or a health system be afraid of the introduction of other forms of that variant? What makes it more of a challenge in handling it, that it would make a country take such adverse measures to ensure that it does not spread to them?
Good question, actually. So COVID-19 variants are rampant over the world, and we're not very sure, but probably they are present in Kenya as well. And these variants are the mutated viruses, and little is known about them till date. So it's always important for the government to face the adverse situations and be ready to do the containment measures of this outbreak by some strategies like screening again with the coronavirus diseases at all entry points everywhere, including hospitals at the level of the country, like the ports, and containment or suppression, like they should have strategies to trace and isolate the cases, and other measures to stop the disease from spreading, and mitigation, like measures taken to slow the spread and mitigate its effects on the healthcare system and society as a whole. So it's important for us to know that coronavirus variants are rampant in the world, and we are not very sure whether the treatment which we used to do for a classical COVID-19 will be beneficial for this for these variants as well.
Right. Honorable Omar, it's quite clear where the UK stands in terms of their ability or their view of how they can handle this variants. Do you think Kenya is ready? We are having a difficult problem even with the virus as is. What about with the virus as is? What about the variants that are also posing a danger to our people?
Trix, let me first of all start with clarifying what variants are.
Yes.
You know, let's define. In simple English terms, variance, variation. So, like, you know, it varies from one to another. That is genetical variations. That is the genetical aspect, makeup of the virus. So it changed from one form to another. That's mutation. So what that means particularly is it does not mean that that virus is more dangerous in terms of genetical means, but it means that it is more virulent or more infectious, which means it can infect more people, it can infect more rapidly, it can go faster. That is what it actually means.
Okay.
So it's just like human beings. You know, say I might be an African, black African, an Asian, a European. We are all human beings, but we are different in our own shapes. So the shape of that virus actually mutates and changes. And the reason why that particularly happens is simply because the host fights the virus, and therefore the virus tries to change itself so that it can particularly be able to deal with a situation in that host. As that happens, when it goes to another person, then that virus is actually mutated to not necessarily a different form, but in genetical means it has got different influence. So it influences the host of the the cells of the new host. So that's what it is. But coming back to your main question, let me put it this way: Britain has better health systems.
Yes.
That's what they say. However, we have already seen in the first wave that they have faced a challenge. So health systems, however good they are, when it comes into a huge pandemic like this one that we have seen this time of the year, since last year, it is quite more challenging and more different. in the sense that it will be affecting more people because of the new variants. And therefore, the new variants is affecting more people simply because there will be more productive coughs, for example. There will be more viral load on the mucus and the likes, and therefore the infectivity or the virulence increases up.
Yes.
Coming to Kenya, we have got a challenge in our health systems. We no doubt about that, compared to the amount of outbreaks that we are having. Therefore, yes, Britain has got a challenge of its own, and they're trying to cope with it, and they have got better health systems. Kenya has got less and poorer health systems, but we are still managing. We're still managing from the point of prevention, and therefore there's quite a considerable amount of hope in Kenya that we will be able to manage the COVID-19.
Okay. Now, that they did what they did, and I'd like Dr. Parag to explain to us, in his view, do you think we are best protecting ourselves in the best way possible? We have the UK having a list, and we're on the red list, and we are having borders open, for example, with neighboring Tanzania. So, do you think we're doing all we can to protect ourselves from other infections and other variants of the coronavirus?
Obviously, I think even to protect against these corona variants, we need to the basics. Like the coronavirus since last year has already taught all the measures to for the safety of the individual and the community as a whole. And I follow the same things. We will be protected from getting infected from this coronavirus infected. So I think better to stick to the basics, like wearing the mask in a very proper way in the public, then staying at least 6 feet away from the other persons, like social distancing, then avoiding crowds or public places, and then washing your hands regularly with the soap and water. And if the soap and water is not available, with your hands together with at least 60% of the alcohol, and coughing or sneezing at the bent elbow, and then cleaning the frequently touched surfaces like doorknobs or tabletops, and getting vaccinated for sure. Yeah.
Okay. Now, Honorable Omar, you have one foot in the medical world and the other in governance. If it were up to you, with that border with Tanzania, knowing all that we know about them being flippant about the coronavirus, would it still be open?
Let me start by giving you some examples.
Yes.
New Zealand and Australia have opened their borders together, and therefore flights are open up there. New Zealand had about 26 deaths, since coronavirus started. Kenya, we've got about 2,000 deaths,
right.
2,200 plus, I guess. If you look at, and therefore, if you look at Australia, that had about 29,000, infections, with about 900 deaths. You're looking at the way they have managed their borders. Therefore, border controls is very important.
Yes.
There's no doubt about that. And after they have managed that, and even the Pacific is actually one of the lowest. If you look at the global trends last week, you will see that the Pacific and Africa were the lowest, with Africa having negative 20% in deaths, which means that there was reduced percentage in deaths that was happening. So I want to look at comparison with countries that are locking their borders, countries that are now currently starting to open their borders. Similar to Kenya now. Are we going to be good enough to be opening our borders with Tanzania? I would say at this particular juncture, the alarm has not reached a red level.
Okay.
We are at the amber level. We are saying we better be cautious, but we better be alert, but not alarmed.
Yes.
At this particular stage. So I wouldn't say unless things have changed, it will change over the next 1 week or so. While we observe, I think, as an expertise in that field, I would particularly say that these borders need not to be closed for the purpose of economy, for the purpose of growth, for the purpose of family reunions, for the purpose of considerable amount of cautioning our economy, which has been, reeling for the last 1.5 years.
Yes.
What we really need to think about currently is to be cautious, to be looking at it, and when I say amber, for others they will call it yellow.
Yes.
At the yellow stage, we will say that we will not hit the red button at this particular stage, I would say.
Okay, Dr. Parag, we are in the third.
And others. The patients is really increasing in this third wave, and they don't have much of a different in presentation, but maybe the infectivity is more of these coronavirus variants, and in fact the seriousness also seems to be a little higher because more of the patients are requiring oxygen support, non-invasive ventilation, and some people are still in ventilators as well. So I think the seriousness is somehow increasing and the cases are also increasing. We are trying to keep them in isolation and basically we as a healthcare provider as well as public as a whole should follow all the government measures which are there in the public to avoid transmission of these viruses. And I feel the lockdown which is implemented by the government is really helping. As we've already seen, it has helped in the first wave as well. So lockdown as well as curfew hours, if we